Hi there, my name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Today we're discussing phonological disorders, what they are, and how speech therapy can help. For young children, part of their development process is learning how to say words correctly. These speech skills develop over time as we learn to talk. Some sounds come easily, like and b. Other sounds, like z and th, are more difficult. Making errors is part of the learning process, but most children can say almost all speech sounds by the time they're 5 years old. Sometimes children will make regular patterns of mistakes among certain words. This is relatively common when children are learning to talk. However, when it extends past a certain age, it may mean a phonological disorder. A child with a phonological disorder may be able to produce individual sounds correctly, but they have difficulty putting these sounds together to form words. For example, they may be able to make the d sound, but they swap it out for the g sound in certain words. So the word go becomes do. Children with phonological disorders are often difficult to understand because they have so many speech sound errors. This can impact their language and literacy skills and affect their experience in the classroom. Signs of a phonological disorder can include saying only one syllable in a word, for example, saying bay instead of baby, simplifying a word by repeating 2 syllables, so baba instead of bottle. The child may leave out a consonant sound. For the word bat, a child may say at or ba. Another sign is changing certain consonant sounds, so saying tat instead of cat. These examples are what we call phonological processes. They're patterns of sound errors or simplified speech rules that children use to make their speech easier as they're learning to talk. These kiddos aren't even aware that this is happening. It's just a way their brain helps them learn to say difficult sounds and words. We know it can be stressful to watch your child struggle to communicate their needs and ideas. The good news is that speech therapy can be extremely effective in treating these disorders. As we've discussed, children with a phonological disorder have difficulty learning the correct rules for how sounds fit together to make words. In speech therapy, they can unlearn the patterns of sound errors their brain created as they were learning to talk. Your speech therapist will use exercises and activities that involve both listening and speaking to help your child reach this goal. The ultimate goal is generalization, when a person can use their new speech skills correctly across a variety of contexts, such as at home, at school, and on the playground. Through it all, your speech therapist will be there to support your child and you every step of the way. Thank you for trusting Expressible to guide you on this journey.